Neuroscience of mindfulness-based practices for client recovery and support of people in the addictions workforce. This will cover information about awareness of one's thoughts, behaviors, emotions, and actions, and how they can relate to both those of us in the addictions workforce and the clients we work with. Mindfulness is a trans-therapeutic practice, and it can mitigate the adverse psychological symptoms for both those of us in the addictions workforce and people with addictions. For those of us in the addictions workforce, we may struggle with burnout, which is characterized by stress, exhaustion, lack of interest in work, compassion fatigue, which is characterized by overly identifying with and being preoccupied with the suffering of those that we are trying to help. The support for both of these, the people within the addictions workforce and people with addictions, can be benefited from mindfulness when we look at the similarity in terms of the characteristics. So burnout is characterized by a stress surfeit, distress intolerance, and loss of motivation. And similarly, people with addictions are characterized with the stress surfeit, distress intolerance, changes in brain mechanisms of motivation, changes in dependence, physical dependence, and negative neuroadaptation. What mindfulness is and how it relates to what we're talking about here is that mindfulness is about paying attention non-judgmentally in the present moment. Mindfulness is also attention training to cultivate self-regulation, concentration, clarity, and equanimity. Mindfulness can help to develop objectivity, change our relationship to our thoughts, and bring awareness to our actions. The key elements of mindfulness-based practices include meditation for attentional focus, awareness of breath, body scanning, somatic experiencing, and yoga, which integrates our somatic engagement of the mind, body, and breath. And together, these practices are designed to help cultivate awareness of physical sensations, interoception of attention to visceral bodily sensations, awareness of thoughts and behaviors, personal insight, and intentional physiological rest and restoration. The science of mindfulness-based practices that are clinically relevant for changes to neural network involved in stress and addictive behaviors, reducing physiological stress arousal, mediating and moderating traumatic stress symptoms, and cultivating and developing cognitive behavioral skills for the management of addictive behaviors, and developing a strengthened positive neuroadaptation. Let's look at how this relates a bit to addictions. Addictions are really about associative learning, conditioning, cueing, and craving. And once the associated sensory cue is learned, then dopamine neurons adapt their response to link the magnitude of the reward with the associated sensory cue. And in this way, the nucleus accumbens in our brains in people with addictions is activated by the cues that we predict about the availability of a drug or something associated with an addictive behavior. Awareness of our thoughts, emotions, and sensations is important for changing behaviors. So the associated of learning, habit formation, and addiction, we have the habit loop, which is 3 key components. We have a trigger or response. We engage in a behavior that makes us feel better. That if that behavior is rewarding, then we have a small release of dopamine, and we learn to continue to do this again. And so this is dopamine-based learning. This is important to understand because when we're talking about changing behavior, we're looking at trying to improve or select behaviors that are perhaps less problematic and less challenging for us in response to those triggers and cues. Sometimes these are, if we look at addictive behaviors, we may have a trigger, stress, physical discomfort. We engage in a behavior such as binge eating, drinking, shopping, gambling, sex. It's rewarding. and we get some temporary relief, and so we then learn to continue to engage in this behavior and do it again. And this is the foundation of rewards-based learning. In the cases of addictions, we're looking at the stress or physical discomfort one may have, some sense of suffering. We use a particular substance or engage in a behavior. It's rewarding, we have some temporary relief, and we learn to do it again. Behavioral neuroscience of addictions and the habit loop is grounded in an evolutionary learning process, and this reward-based learning process is called a positive and negative reinforcement. We see some food that looks good, we eat the food, it tastes good, our body sends a signal to our brains, we remember what we are eating and where we found it, and we lay down context-dependent memory and learn to repeat the process. Drugs of abuse and addictive behaviors induce persistent remodeling of reward circuit function, and the addictions that are also associated with what we call a stress surfeit, strong cravings and brain alterations can serve as triggers for re-engaging in that behavior. What happens here is what we look at is negative neuroadaptation that gets developed. And the negative neuroadaptation, we see that neurons that fire together wire together. And so we start to see changes in terms of the neural networks and the neural pathways that make these behaviors, the connection between the trigger, the cue, the behavior, and the reward, somewhat difficult to be aware of. So they become automatic. If we cultivate awareness of that connection and the fact that stress is being triggered or that we are responding to a cue, then we have, with mindful awareness, we have the opportunity to positively respond to that stressor or that trigger in a different way. So, for example, avoiding opioid use, regulating impulses, and the like. When we continue to engage in this, our reward is that relapse is prevented or that we foster healthy neurocognitive patterns that are strengthened. And this is the basis of positive neuroadaptation development. The foundations of mindfulness-based approaches to recovery, we see that the development of the capacity to investigate our own thoughts, emotions, and behaviors help in terms of reducing reactivity to distressing thoughts and emotions, fostering distress tolerance. This is important for practitioners, people working in the addictions workforce, as well as for the patients and the people that we work with who are suffering with addictions. It increases cognitive and attentional control, helps to mitigate stress reactivity, change the function of neural pathways that are underlying the stress and addictive behaviors. What mindfulness mechanisms of mindfulness for recovery can help to show us is that it can decouple the stress reactivity and craving neurocircuitry. Mindfulness changes brain regions implicated in both mindfulness practices and addictions, notably the anterior cingulate cortex and the striatum. And these changes are correlated with greater mindfulness characteristics and a decrease in craving, and also a decrease in the quantity of substances used when we're looking at drug addiction. It changes brain regions associated or correlated with attentional control and decreases the stress response. Research has shown that mindfulness-based interventions can foster self-regulation, and self-regulation is essential for distress tolerance, managing cravings, and fostering mental and physical well-being, whereas poor self-regulation increases the risk of developing addictive behaviors, as well as relapse and return to use. And this can be important for both people working in the addictions workforce as well as the patients that we work with. Because for addictions professionals, when their stress is unmitigated, they are also at increased risk for maladaptive health behaviors and or addictions. Research has shown that mindfulness-based interventions foster self-regulation, reduce cravings, reduce traumatic stress symptoms, and can prevent return to use. Mindfulness-based interventions bring about clinically relevant changes to neural networks, physiological arousal, trauma, stress, and addictive behaviors through cognitive, behavioral, skill development, and positive neuroadaptation, thus improving client outcomes. And it's equally important for the addictive workforce to take active role in protecting their own well-being to prevent burnout and stress. Here we'll look at a little bit of what happens cognitively and in the neuroanatomy of the brain in response for people who are under stress, and we look at in the addictions process as well as people under a stress surfeit. So the stress response is amplified with addictions and trauma, affecting both addictions workforce and patients. In the cases of stress, we tend to develop a very strong connection and neural pathway between the thalamus and the amygdala. The thalamus regulates sensory input, and the amygdala is sort of like a security guard that is on hypervigilance, looking for potential threats. Also, under chronic and ongoing stress, we tend to have a less of a connection between the prefrontal cortex, where we do most of our thinking, and the thalamus. So we see a weaker connection between those two areas. Therefore, we may be more overreactive and falsely interpret sensory input. Through mindfulness-based practices, there's changes in the brain, and meditation, which is a self-regulatory practice, strengthens the connection between the prefrontal cortex and the thalamus so that we can more accurately interpret sensory cues in the environment and sensory cues in our body. And this reduces reactivity and negative mood states. The neuroscientific mechanisms of mindfulness. So what happens here, so if we see the basic elements from the trigger, the behavior that we may engage in, and the reward, here we see a more extended cycle of behavior. So applying mindfulness skills, as we see here in these green boxes, can help us to be aware of the thoughts, sensations that trigger, that are activated by the trigger, and we can then make a choice about responding rather than reacting to those triggers. Awareness of thoughts, sensations that trigger cravings and habitual behavior can help to support and reinforce adapting new behaviors. And this enables us to interrupt the habit loop and establish new, healthier behaviors. Mindfulness training breaks the link between the urge and the action by targeting the habit loop. It's been shown to be an effective treatment for substance use disorders, traumatic stress, depression, anxiety, pain, and many other maladaptations. Locating the sensations in our body that are at the root of craving, stress, can help be a helpful way of applying practical skills of mindfulness. And here we're going to look at and learn a little bit about mindful surfing. So we can't stop the waves of what is coming towards us, but we can learn to surf thoughts, sensations, emotions, and cravings. We'll walk through a little bit about what this experience is. We'll begin by locating the sensations of craving in the body, exploring where one can feel it, where is it located, noticing each place in the body where it's felt. Choosing one of the strongest sensations to work with, paying close attention to it, being as specific as possible, taking a deep interest in it, can help us then to gain some objectivity and distance from these sensations. Notice what happens. Does the sensation intensify or diminish? Is the location constant or does it travel? And what research shows us is that by using these techniques, we can decrease the intensity of thoughts, emotions, and sensations. We can also decrease the intensity of cravings. So using what's known as the RAIN technique, which is recognize, accept or allow, investigate, and notice what is happening, we find that the intensity of cravings become less and less with each subsequent wave of craving. So the diagram here on the left side of your screen shows an illustration of the period of time in which a craving may exist, usually about 20 minutes or so, and the decrease in intensity that research shows us people experience when they have applied the mindfulness skills of observing, not just suppressing the craving or the intense feelings and emotions, but allowing them and investigating them and noticing that they do dissipate over time. It is out of this very ground of suffering that we can contemplate well-being, and it's in the muddy waters that the lotus grows and blooms. These words can be helpful for us to remind how, out of suffering, our own or that of the clients that we work with, we can become stronger and beautiful things can emerge.